So, today's seminar is dedicated to a relevant topic for PROTECT-CHILD, NIS2 and secure processing environments in the European health data space. And the aim is to better understand the NIS2 directive, explore its implications for secure processing environments, and reflect on how it might influence our technical implementation. For this seminar, we are very pleased to have with us Dr. Francesca Tassinari from the University of the Basque Country. She holds a PhD in international and European law, and her expertise covers privacy, interoperability, and European data law. And now, Francesca, thank you so much for joining us. The floor is yours.
Yes, thank you very much, Nerea. Thank you for the organization, for inviting me. It's good to see also friends and colleagues connected. I was very pleased to receive the invitation and also challenged by the topic that I've been assigned in the frame of the project you are dealing with, Protect Child. And as I said to Nerea as well, I will remain available in case there is any willingness or pleasure to look forward and go in depth with with this topic and to write something more, let's say, detailed also in the near future. I was, as I said, a bit challenged and surprised by the topic, as we are dealing with two important instruments, EU level instruments. One is Directive 2022/2555 that aims to establish high common level of cybersecurity across the Union. We will refer to it as NIS2 Directive. And the other one is the regulation of 2025, more recent one, number 327, establishing the European Health Data Space. And as I said, the idea was actually challenging because the European Health Data Spaces, which is the regulation I've been working on more in the past year, and maybe also a new one. The European Health Data Space regulation does not mention, expresses, or makes reference to NIS2 directive. As far as I have been scrolling it, I hope I have not missed anything in that sense. But in any case, it is actually important and to establish this connection among different EU instruments. Among these two instruments, the connecting line is actually the Secure Processing Environment or SPE concept. As we will see later on, it is, let's say, a future present in European Data Space Regulation, but also in other important instruments in the EU digital environment that actually requires for some elements enhancing security from a cyber regulation perspective. So we will try. I'm not sure I will manage it, and as I said, I'm happy to elaborate further also in the discussion. I will try to present NIS2 directive and the European Health Data Space regulation, while trying also to make some already during the presentation some correlation among the two instruments. The main goals will be to assess whether actually NIS2 and how the NIS2 directive have an impact on the European Health Data Space regulation, and specifically on the implementation of secure processing environments, and at the same time identify how a NIS2 directive shapes the secure processing environment framework and requirements. So starting with directive NIS2 directive, so on the cybersecurity side. So directive NIS2 directive his main goal is to achieve a high common level of cybersecurity across the Union in order to improve the functioning of the internal market-based on Article 114 of the Treaty on the Functioning of the European Union. As a directive, it needs to be transposed. It was due to be transposed by September 2024, and in this sense, I am, let's say, sorry to say that I am afraid that Spain is not still on the pipeline and has not yet transposed it. But as far as I've seen, there is an anteproyecto de ley published in January 2025. So might be also is infringing actually transposition deadline. And as we all know, then this means that the directive can be direct, have some direct implication or direct effect in specific circumstances, but in general needs still to be transposed by these member states. And mainly what does the directive, NIS2 directive does, because as we are saying, we are talking about NIS2 means that we already had a precedent instrument that dates back 2016. So first of all, it imposes member states to adopt national cybersecurity strategies and to designate or establish some new bodies or organs, competent authorities, cyber crisis management authorities, single point of contact on cybersecurity, and computer security incident response teams, mainly. Moreover, the directive imposes to essential and important entities to to adopt cybersecurity risk management measures and to comply with reporting obligations. Moreover, rules and obligation. There are some rules and obligation on cybersecurity information sharing, and last but not least, the NIS2 directive contemplates supervisory and enforcement obligations in order to effectively watch over the member states' correct implementation of the. As a way of bit of a summary, compared to the previous instrument, there is a larger number of organizations involved. Now we are we are covering 18 sectors. Organizations must be able to assess the risk of a cyber attack through the whole supply chain in advance in order to take appropriate measures. Cyber risk management has become therefore mandatory. Employee needs to be trained and have some, and there is also cybersecurity audits following any cyber attacks. Management is personally liable for any damage caused as a result of failing or fulfilling the obligation imposed by the directive. There are some penalties as well imposed in case of breaching the directive. And strict reporting requirements must be adhered to by the member states that, as I've already said, must designate a computer and security incident response team. The scope of the directive, of the NIS2 directive, is a bit actually, it was a bit actually, let's say, not new. Let's say things for digital and instruments at the EU level, but it's a bit of a puzzle, meaning that the NIS2 directive applies both to public and private entities that are listed either under Annex 1 for that points out to high critical entities, or Annex 2 of the directive that gather other critical entities, and which qualify depending on the two main parameters. So either on the size, so in order to fall under the scope of the directive, the entity must be a medium-sized enterprises under recommendation 2003/361 of the European then community, or bigger. This means that the an enterprise should have fewer than 50 persons as employees, and as an annual turnover or an annual balance sheet that does not exceed 250 persons, and a balance sheet of 50 million euros, more or less. Otherwise, and notwithstanding the size of the entity, also entities that fall under the NIS2 directive are those that are listed under Article 2.2a to F of the NIS2 directive, among which I wish to stand already out that there are entities, the disruption of the services provided by entity that could have a significant impact on public safety, public security, or public health. So public health, which is also related to European health data space in a certain way, as we will see afterward, for secondary use of electronic health data. Also critical entities that are defined under the Directive 2020, another Directive 2022, on the also known as Resilience of Critical Entities Directive. And this directive as well in its Annex 1, in its annex attached, provides for entities related to covers entities related to the health sector, specifically healthcare providers, UL references laboratory, entities carrying out research and development activities for medical products, etc., etc. I will leave you to maybe to go through it, opening the annex to the critical resilience of critical entities itself. Entities providing name registration services and member state entities, public administration entities at local level, and education institution where they carry out critical research activities. Also, member states, other union instruments and member state may point out critical entities as such falling under the NIS2 directive, and that are therefore have to comply with the obligations imposed therein. There is also reference under the NIS2 directive to the GDPR and the need to respect privacy law. Another important instrument we are not going to tackle, but as we know, that also makes reference to security measures for data protection goals. The NIS2 directive mentions, so cover as high critical entities or other critical entities, the health sectors, both and therefore respectively under Annex 1 and Annex 2 that you can find in the slide projected before you. So according to Annex 1, the health sector is covered healthcare providers as defined in the appropriate regulations. You reference laboratories, entities carrying out research and development activities of medicinal products, entities manufacturing basic pharmaceutical products, entities manufacturing medical devices considered to be critical during a public health emergencies, and other critical entities that produce health products and health products for diagnosis, research organisms, and entities that dedicate the core of their activities to applied research or experimental development. What are therefore the main obligations that the NIS2 directive impose to all those entities that we have mentioned so far? There are obligations directed to the member states and obligation directly straightforward to the entities themselves. So as far as member states are concerned, the NIS2 directive imposes each member state to adopt a national cybersecurity strategy under Article 7 of the directive that provides for the strategic objectives, resources as well, and policy and regulatory measure in order to achieve and maintain a high level of cybersecurity, which is the main goal of the NIS2 directive. And secondly, a policy framework for enhanced coordination between the competent authorities established under the NIS2 directive and the competent authorities established under the Critical Entities Resilience Directive that I have already mentioned to you, in order to share information on risks, cyber threats, and incidents. Secondly, Article 9 imposes to the member state to adopt a national large-scale cybersecurity incident and crisis response plan, where the objectives of an arrangements for the management of large-scale cybersecurity incidents and crises must be set out and well defined. So from a governance perspective, as I've already introduced, this requires member states to implement, to establish new bodies and organs, competent authorities that are responsible for cybersecurity and the tasks of enforcement under Chapter 7, cyber crisis management authorities, computer security incident response teams that specifically are in charge of handling incident in accordance with a well-defined process. They are also open to cooperate with international network and shall promote the adoption of common or standardized practices classification schemes. And last but not least, also member states, as I mentioned, have to establish single point of contact that are usually used to, as in all area of EU law, to establish liaison function to ensure cross-border cooperation among the member states. There is also another let's say, supranational, I would skip this, also another level of bodies that are, let's say, another networks that try also to make in common and to connect all the bodies established within the territories of the member states. Then, before passing to the specific obligations, two main obligations, most important, that the NIS2 directive imposes to entities. The NIS2 directive refers and makes an explicit distinction between essential and important entities under its Article 3. So this is why I also said before it's a bit of a puzzle in order to understand its scope, meaning that in addition to the criteria that I've described at the very beginning, in order to single out which entities are affected by the NIS2 directive, also there is an important one in discerning between essential and important entities. Essential entities are defined under Article 3 as are listed as entities of a type referred to in Annex 1, meaning high critical entities that exceed the medium-sized enterprises, qualified trust services providers and top-level domain name registers, providers of public electronic communication networks, public administration entities, other type of entities referred to in Annex 1 or 2, identified by the member states themselves, entities identified as critical under the Resilience of Critical Entities Directive, and if in case member states have defined it, operators of essential services. Important entities, conversely, are defined by default, so all those entities that are not considered as essential. Two main obligations, I think, I would like to flag in order to remember that with respect regarding to the second part of the presentation, focus on the European Health Data space, which is the adoption of risk management measures, and reporting obligations. So as far as risk management measures are concerned, Article 21 of the NIS2 directive imposes to the member states to ensure that both essential and important entities, as we defined before, take appropriate and proportionate technical, operational, and organizational to manage the risks posed to the security of network and information system which those entities use for their operation or for the provision of their services, and to prevent or minimize the impact of incidents on recipients of the services and on other services. So first main obligation is to adopt cybersecurity risk management measures as a sort of a pre-measure in advance a priori to be adopting. And taking into account the state of the art, relevant European and international standards, for example, ISO standards, as well as the cost of implementation, the measures that must be taken in the frame of this risk management measures framework shall ensure a level of security of network and information systems appropriate to the risk posed, with a sort of proportionality test with regard to the degree of the entity's exposures to risks, the entity's size, and the likelihood of occurrence of incidents and their severity, including the societal and economic impacts. And then afterwards, there is a list actually of elements that needs to be taken into account when drafting and planning the cybersecurity risk management measure policies on risk analysis and information system, incident handling, business continuity plan, etc., etc. I'm not going to read the whole paragraph, not to bore you too much, but I will be happy also to share the PowerPoint. But in any case, these are all listed in Article 21 in even more order than I did in these presentations. And the second main feature that I have, at least that I think might be relevant for SPE under European Health Data Space, is actually the reporting obligations under Article 23. And Article 23 states that each member state shall ensure that essential and important entities, so the two main entities tabbed before, notify without delay to its computer and security incident team, or if applicable, its competent authorities, any incident that has a significant impact on the provision of their services as referred to in paragraph 3. And paragraph 3 define a significant incident with the two main requirements. An incident that has caused or is capable of causing severe operational disruption of the services or financial loss for the entity concerned, and it has affected or is capable of affecting other natural or legal persons by causing considerable material or non-material damage. So this is the second main obligation that we find in the NIS2 directive, applicable to essential and important entities, in order to manage significant incident or incident that might have a significant impact from a cybersecurity perspective. And then in case, of course, there is, let's say, a sort of, I would say, domino effect that could impact other member states, then also the cooperation mechanism should be activated in order to make all the bodies competent national contact points, let's say, aware of it. And I wish to close this first part by flagging this disposition, which I find interesting. I think it is a bit of a key in order to understand the relationship also with the European Health Data Spaces. Because Article 4 of the NIS2 directive states that the compatibility of the NIS2 directive with sector-specific union legal acts. And I think, but I'm happy also to have your perspective on this point, that actually the European Health Data Space could be seen as a sector-specific union legal acts. I would be happy also to have somebody from the Commission to ask to understand who they were thinking upon when stating this. And basically, when sector-specific union legal acts require essential or important entities to adopt cybersecurity risk management measure or to notify security incidents, so the two obligations we saw before, and where those requirements are at least equivalent in effect to the obligation laid down in the NIS2 directive, the NIS2 directive do not apply to such entities. And specifically, when cybersecurity risk management measures are at least equivalent to those as laid down in Article 21, 1 and 2, and afterwards sector-specific union legal acts provides for immediate access to the incident notification by the bodies established for crisis security and the crisis security teams, the competent authorities, or the single point of contact under this directive, and requirements to notify significant incidents. As I was saying, meaning that in case of when the measures established, let's say when the measures overlaps with Article 21 and 20 and 23, and are foreseen in another sector-specific instrument, the sector-specific instrument would prevail for the lex specialis principle, I would say implicitly. So European Health Data Space Regulation, which I would say is the one I have been digesting more in the last months. I had to. Was not a pleasure, but no, I'm joking, of course. It's actually a very important piece of legislation, because it's the first data space we have on board and approved, adopted by the European Union. So the regulation establishes European Health Data Space Regulation wants to establish common rules, standards, and infrastructures and governance framework in order to facilitate the primary and secondary use of electronic health data. Primary use, meaning, what does it mean? It's the use of electronic health data in order to improve, let's say, our daily life and our movement across the Union, to have a single clinical, electronic clinical file, and in order to store our health data belonging to natural person in an interconnected way, but maintaining the respect of a federated environment in terms of governance, data governance model. This is not of our interest today. It is instead the secondary use of electronic health data. The secondary use is actually allowed only for the purposes specified under Article 53 of the European Health Data Space Regulations, that goes from reasons of public interest in the area of public and occupational health, national, multinational, and level official statistics, education or teaching activities, scientific research related to health, development of products or services contributing to public health, etc., etc. And also, I wish already to flag the fact that both primary and secondary use, let's say, have their own infrastructure supporting the processing and sharing of this data. So while My Health at EU was already present and is still kept by the European, it was already present under the previous directive of 2011. A new infrastructure of health data at EU is introduced in order to share electronic health data for secondary use among the member states. It is important then to flag and to remember that regulation, the European Health Data Space Regulation, regulates both electronic health data in general. So we are referring to both personal and non-personal data. And that we have, let's say, a governance model that I tried to display in a slide later on, made of three main actors: data holders, data users, and health data access bodies. So data holders are healthcare providers, are those that actually already have health data in their hands, meaning in their databases. Healthcare providers or public care providers, private, public, non-profit, private organization, association, public and private research entities in the healthcare sector that processes categories of health and health-related data, with the only exception of micro enterprises, which in my perspective is in line actually with the NIS scope, meaning that we understand that small enterprises are neither affected by the NIS2 directive nor by the European Health Data Space Regulations. Then we have data users, so those natural or legal person who has legitimate access to personal and non-personal electronic health data and are authorized to use it for commercial or non-commercial purposes. And then health data access bodies that facilitate the access to electronic health data. So basically, they receive data users' requests to access or the petition of data, and let's say contact data holders in order to make them available in our famous secure processing environment. These we are moving in the health data at EU infrastructure, meaning that, and this I've added this point because it also already refers to the secure processing environment concept. So in case of when, for example, a user and here I display it, when we have an access application or a request of electronic health data, and these are stored, for example, in another member state, which is, by the way, known because there is health data at EU will store the catalog of electronic health data. There is an obligation imposed by the European Health Data Space Regulation to communicate the dataset catalogs they already have in their hands in order to make available, the understanding on where those data, in case of a request, if those data exist, which are the characteristics of those data, and where they can be retrieved. So already to join health data at EU, so ready for member states, national contact points, or union health data access services, to join this platform, to join this infrastructure, there is a need to respect the secure processing environment requirement. And these are all called as authorized participants. And without complicating too much the presentation, authorized participants could also be international, third countries or international organizations. And then the services provided here as well, among the services provided in the health data at EU infrastructure, we've also find secure processing environment, because also in this frame, it is possible to make available the secure processing environment in order to transmit and analyze the data in case the controllers request it. So, by the way, it is very also a bit complicated, the subdivision of well, complicated, not actually, it's great that it's already set down in my perspective, but the distinction between data controller and processor under Article 74 of the European Health Data Space Regulation, which is really important, and because in the specific case of the secure processing environment, data users remain the controllers of the processing activity done within the SPE, while the processors are actually either the European health data, either the health data access body, other third parties that could be also delegated this task. So this is a bit of a summary of how the European Health Data Space Regulation try to regulate the access to health data, electronic health data, and the result and the outcome of it. As you see, the secure processing environment is basically at the end of the cycle, because first of all, health data, electronic health data, can be accessed or requested by the so-called users, as we see it. And then such a request should be addressed to health data access bodies. So what's the main difference? In case of an access applications, means that data are merely accessed and governed under Article 67 of the European Health Data Space Regulation, we are always thinking upon secondary use. Also in this case, when the user submits a health data access application, it is requested to specify him or herself if there are some data sets to be brought. So if the user himself or herself is intended to bring some data sets in this secure processing environment, if they exist, the period during which electronic health data are to be processed therein, and a description of the tools and computing resources needed for a secure processing environment. And then there are other requirements that I have already flagged to you, but less relevant for our presentation today. Purposes, legal basis, data necessary, tools, opt-out, and also important for the also for the minimization principles, whether data are asked in a pseudonymized format, which needs to be justified I mean, it needs to be justified why they cannot be obtained in an anonymized, obtained, sorry, it's not the appropriate, it will be accessed in anonymized format. Different is the request. Health data requests are regulated under Article 69, and the aim is only to obtain data in an anonymized statistical format. So in this case, there is no access to the data, to the health data, either as before in a pseudonymized or anonymized format, but there is only an intention of obtaining a response in anonymized statistical format. So in this case, maybe colleagues could correct me if I'm wrong. So in this case, we are not touching GDPR, we're not touching personal data. And the request again must include, for example, here SPE is not mentioned expressly. So we could also say maybe that, which is a bit weird, we could also say that maybe SPE is more thought and designed in order to protect those processing that affect personal data, but it's actually not said by the e-health data space regulation. But it says that a description of the safeguard in place to prevent any misuse of electronic health data must be highlighted. And so in case, and recalling our process mentioned before, once the health data access application or request is submitted, the health data access body evaluate it and let's say look for the data that are requested and issue a data permit or approve the request received in a period of generally 3 months. And in case, for example, in case it receive an access request, but consider that data can be provided in anonymized format, so it can also turn to the second less invasive option. And also interesting and important is to state that member states may also establish a procedure through which data holders can be designated as trusted health data holders. And this is important because in case the data holders, so the entity that actually held the data, can be designated as trusted health data holders, then they have to prove themselves that they can provide access to health data through a SPE that complies with Article 73. So, and this is important because it means and already suggests that the SPE can be provided either by the health data access body or by trusted health data holders. If the data are so in case the data are found and everything is okay, then these are put at the they are shared, let's say, and made available through a secure processing environment for a period of almost, as a general rule, of 10 years. When it goes specifically to secure processing environment that I have already mentioned a bit from time to time, the secure processing environment is defined under the Data Governance Act. And the European Health Data Space Regulation makes reference to it. The European Health Data Regulation states that every access to electronic health data for secondary use must be done through a secure processing environment. And this is the physical or virtual environment and organizational means to ensure compliance with union law, such as GDPR, in particular with regard to data subject rights, intellectual property rights, commercial and statistical confidentiality, integrity, and accessibility, as well as with applicable national law and to allow the entity provided a secure processing environment to determine and supervise all data processing actions, including the display, storage, download, and export of data, and the calculation of derivative data through computational algorithms. So, secure processing environment is a guarantee foreseen by the European Health Data Space Regulation that impose strong technical and security safeguard for electronic health data, pseudonymized or anonymized, the health data access body, or where relevant, as said before, the trusted health data holder that must provide access to such data in a secure processing environment. And complying with high technical and security standards are actually not defined in the European Data Space Regulation. This is why I think here we find the main one of the main obstacle. We have an important element suggesting that SPE must comply with GDPR, including when SPE is managed by a third party, meaning when the SPE, as I've said, I've excluded a bit, though even if it's the part like the most the international dimension, so the possibility to transfer or share personal data with third countries and international organizations, and how these actors must comply with the SPE requirement. The secure processing environment must reduce the privacy risks related to such processing activities and prevent electronic health data from being transmitted directly to the health data users. Specifically, only non-personal, it must ensure that only non-personal electronic health data that do not contain personal electronic health data should be downloaded by the health data user from such secure processing environment. Because actually, this is one of the main pillar and idea of the European Health Data Space Regulations. I forgot to mention that also. I thank Professor De Miguel Beriani for his support in this part of the presentations, and because he's really the master on the part on the European Health Data Space Regulations. So, colleague at the University of the Basque Country, it's actually one of the main pillars: the fact that data should not leave the environment where they are, but must be kept safe in the secure processing environment. So, according to this, I would say that it's pretty. How can I say? It's pretty evident that actually SPE at least is one of the measures, that one of the main, maybe not the only, but one of the main purposes actually to safeguard the GDPR requirements. And in order to preserve rights and freedoms of natural persons. So, as we all know, the privacy and data protection fundamental rights of the Charter. And also the Commission, according to the European Health Data Space Regulation, and actually the Commission has some implementing powers related to it, should assist the member states in developing common security standards to promote security and interoperability of various SPE, because also in another point of the regulation, it is also actually enhanced the necessity of ensuring interoperability, not only now among within the European Health Data Space, but in the future also with other data spaces. So, as I said, one of the main challenges is that there is no common international or domain-specific standardization and certification requirements for SPEs. And there has been a proposal that I was also colleagues was sharing with me to harmonizing the development of SPEs. This would mean also working from a bottom-up level in order to understand how to align the requirements of SPEs. And also in a way that the SPE requirements remain flexible in the future. So The European Commission has the responsibility, first of all, to establish the responsibility of the controllers and processors for SPE managed by the European Commission, to establish in via implementing powers, technical, organizational, information security, confidentiality, data protection, interoperability requirements for SPE, including with regard technical characteristics and tools available to health data user within SPE. So here, this means an important element in order also to understand the standards that will be adopted, and assessing that a national contact point for secondary use of a third country or international organization is compliant with health data at EU requirements, meaning that also when adopted the famous adequacy decision in order to say the third country or international organization is apt to join as an authorized participant health data at EU infrastructure, the SPE requirements must be met. So as a way of, so we have understand so far that SPs can be operated by, I'm coming to almost the end, health data access body, a trusted health data holder, and a third-party SPE provider. One of the main feature is to ensure control, that the access, in case of access for visualization of data, analysis of data, is controlled via, for example, logging solutions. SPs will be audited and must develop tools and computing services to meet user requirements. And also, there is a need to control. And here, for example, I have experience when working at the Commission on controls of longevity. You say when let's say when we talk about the control of the deletion of data according to the minimization principles as well, and corresponding rights of the data subject, then there are also automated cleaning mechanism that can be inserted in SPE in order to delete the data when the time expires. Then one other SPE requires to incorporate user needs, especially cultural change in service provision and corresponding training staff. This is the part of the training and education, let's say, of the staff managing secure processing environment. And here it also, let's say, a bit aligned the European Data Space Regulation with the NIS2 directive in terms of the education of the staff regulating and prepared in terms of cyber security threats and incidents. And yes, as a way, a bit of conclusion, setting SP requires sophisticated infrastructures and expertise that not all the member states have. And also ensuring data quality across different jurisdictions is a complex challenge. National sovereignty concerns some of the data. There could be also some sort of what we were calling data ownership principles, also a bit of a jealousy about some member states to create a cross-border sharing and to facilitate cross-border sharing of data for secondary use, and therefore also to align with SPE requirements. And while the European Health Data Space Framework establishes health data access bodies, to facilitate the access, there are discrepancies. There could be, and could be discrepancy in the interpretation also regarding SPE that create inconsistencies. And addressing this issue will require their convergence, political will, and regulatory alignment and technological advancement to ensure this equitable adoption of European data spaces across all the EU member states. So in order to, I think that what is missing, a bit also self-critical, so what is missing now in the presentation could be some more examples But on the one hand, I finished my time, and on the other hand, I confess that I have not jumped into that part of the research, which I think it could be interesting to see actually in practice how to align SPE with NIS2 directive. Because if we refer to the provision so the European Health Data Space regulations does not say that much about does not say anything about the NIS2 directive, but not say that much about security incidents as well. Differently for other instruments I have been working on, where we were actually laying down security in specific incident framework. We have to wait to see the implementing power of the Commission, how they are developed. But if not, by default, in my perspective, NIS2 directive, yes, should also influence in terms of the obligation we have seen before, risk management and also obligation of reporting the implementation of secure processing environments. How much the NIS2 directive shape the secure processing environment framework and requirements? I would say this depends also on how much, as I said before, how much is left once the European Data Space is actually implemented. But I am happy because I'm aware that these are not definitive answers. I'm aware that that there are some missing links among the dots and all the work that I have been commenting to you to discuss it now. I wish to thank you for your attention, and I'm happy to discuss and receive your questions now.
Francesca, many thanks for sharing your knowledge with us. And well, thank you also all the attendees for being here, for listening to our great presenter.